Hi, very good afternoon to everyone present here today. We are on Wednesday at 3 p.m. as usual. That's when we take our webinars. In this week's live session with Oralia Dental, we wanted to address a very important topic. We've been coming across a lot of our patients, and the topic for today is how to deal with dental emergency. Of course, when we see this with a lot of patients, we have patients who come into us at the very last stage of decay. Your teeth is grossly decayed. They have not understood how to recognize what the problem is and how they can visit either their nearest dentist or maybe even an emergency, right? Dental emergencies are something that everyone at some point of time will have, but what happens when you encounter something like this on a holiday or on a weekend or in the middle of the night? If you're dealing with something very severe, you may not even need to go to a dentist. You might have to go to an emergency room in a hospital, right? We thought we will shed some light on this topic today. Now, what are the 4 most important things you need to consider with the dental emergency? We thought we'll give you a little bit of heads up on it. The 4 things you need to consider first would be how to know if this is actually a dental emergency, number 1. Number 2, what is not a dental emergency? We'll give you some examples about that. What are the most common dental emergencies that you can find and you can face? Last part, how can you avoid all of these emergencies, right? Top 4 part. Now, you might be in any normal dental situation. It can be decay, it can be even a fracture, you might have been met with an accident. At this point of time, you really need to understand what the problem is and who you need to go see. For example, if unfortunately you've met with a RTA, which is a road traffic accident, you happen to have a knock on your chin, or you have upper maxillary issue, or your upper jaw is hit, and you can feel something's off. At this point of time, you just going to any dentist may not be the right thing for you to do. If you really have to go to a dentist, you might want to look for an oral and maxillofacial surgeon, or you go to an emergency room in the nearest hospital. They would know how to handle with this kind of an emergency. They know how to reduce your fracture. If there's a fracture, they will have a radiograph facility immediately available, so you can assess the depth of damage to the bone. This is not just dental, this can also be a skeletal issue, right? Most important thing, yes, there are inpatient facilities. If you need to be admitted immediately, you can. If there's any IV requirement that needs to be given to you, you can. But this is very important for you to recognize when and where for you to go. Now, for most patients, when they come to our practice, we give them 5 questions, and we tell them, you need to ask yourself this: if you're feeling any of these things when you feel pain, right? That's how you decide on whether this is a dental emergency or if this is something that you can wait overnight, take some medicine, and then go see your dentist later. Number 1, are you in severe pain, right? This pain can be with or without bleeding, but severe pain at any point which you cannot comprehend, you cannot understand why, is every reason to consider it as a dental emergency. You can go to your dentist immediately, or you can even go to the ER, and they will give you painkillers. They will even assess the reason why you have such pain, right? Have you lost a tooth recently? Healthy individuals should ideally not lose their teeth because of gum issues, but then why we say this is if you lost a tooth in case of injury, where we call it tooth avulsion. If you visit the dentist on time, if you visit the practitioner on time, there's a high possibility that you can save the tooth as well, right? A fast treatment can potentially save your tooth. Number 3, do you have loose teeth? Loose teeth means something's wrong with your gum, something's wrong with your bone. It indicates to direct systemic health. For example, if you're a heavy, uncontrolled diabetic, you can have gingival issues, periodontal issues. This could lead to your teeth shaking. No adult should have a complaint of loose teeth. That can be a dental emergency, with or without pain, right? You can consider that a serious problem. The last part would be, have you any infection? Does it feel like you have an infection? An abscess is an infection, a swelling is an infection. Anything that is really, it gives you more of a swelling, it gives you something really difficult. You're not able to chew, you're not able to sleep in that area. Even if you lie your head back, it's heavy. All these are signs of infections. Infection in the dental sense is a potential life-threatening risk. We never tell patients to ignore this. A lot of our patients want to take some home remedies. They will try their best to avoid going to the pharmaceutical route or even coming to us for consults. But we tell them don't risk it. It's not worth it. A normal infection that is present under the tooth can lead to a massive swelling, extraoral swelling, and then it just gets more and more complicated for you to fix, right? Also, one of the dental emergencies that we've seen of late are bleeding from the mouth. It can be from the gums, but even if it's just bleeding from the mouth that you're not able to explain, it's a potential sign of emergency. You really might want to go to the dentist or the emergency room to address this, right? Now, having said all of this, let's say you've assessed this. You've seen all these questions. You've asked yourself these questions. And yes, now you want to know what are some of the examples of dental emergencies. We'll give you 9 examples of the most common dental emergencies. You may want to write this down. You may want to make a note of this at some point of time. If you come across this, you know exactly what to do. Number 1, unexplainable toothache, right? You're absolutely fine. You had your dinner. You went to sleep. You're just not able to sleep. There's throbbing pain, throbbing, gnawing, long-standing pain, which you're not able to comprehend. Now, there could be multiple reasons for this. It could be a fracture, the tooth has vertically fractured into two, or maybe there's a horizontal fracture because of what you ate. You might not realize this immediately at that point, but this could be one of the reasons. Now, you have to go to a dental practitioner or an emergency room to get this done because, one, the pain, if it's so severe, you may need immediate attention for it, right? Number 2, swollen gums, bleeding gums. Now, swollen gums can be for a lot of systemic condition, which is why you need to consider this as an emergency. Bleeding gums also is a bad sign, which means either you are an uncontrolled diabetic or your entire periodontal health, your gingival health is in trouble because of a lot of cleaning that's required under the gums and you haven't visited your dentist on time. If the bleeding actually starts and you're noticing bleeding while brushing, bleeding even while eating or drinking something, dental emergency, you might want to visit your dentist, right? Third part, swollen jaw or mouth. This is a straightforward sign of infection. A swollen jaw swollen jaw should have been the first thing, but if there's a swelling here, you need to be very cautious. You need to be very vigilant about this. You need to immediately go to the emergency room. If you're going to a dentist, you may want to go to a maxillofacial surgeon who's a head and neck specialty surgeon. He might immediately be able to do an incision and drainage for you or put you on very strong antibiotics so the infection can come down. It's a very painful process, so please keep in mind to not ignore this. If there's any kind of swelling, immediately go to the dentist or immediately go to an ER and you can get some attention right away on it, right? Exposed nerve. Now, exposed nerve is one of those things where if you have an injury, you knock your tooth out and the tooth snaps in half, right? And every tooth we have a nerve ending inside, and if that's an exposed nerve, one of the most painful things that you'll ever experience in life. Exposed nerve is something you should not put up with, and please don't try creative ways at home to manage this. There is a protocol for this at the dental office, and the minute you go, the doctor will give you local anesthetic, you'll be out of pain, and there's a way of removing the nerve ending that's infected or damaged, and there's a medication that's placed. You don't have to put yourself through so much of pain, hoping that what you're trying at home will help you, right? Don't put yourself through this. Just go to your dental specialty clinic or go to your dentist, and they will know what to do to relieve you of the pain immediately, right? Knocked out tooth, the most common thing we see this in children, even in contact sports, football, boxing, you name it. Contact sports, what happens is due to a sudden impact at a short duration of time, your tooth just pops out of the socket. This is an emergency. Of course, the tooths come out. If this is not an emergency, then what is? If you know how to manage and how to maintain the tooth, you can save the tooth. Now, this is called a tooth avulsion. And when the tooth are avulsed, the easiest thing for you to do is take the tooth without touching the root part of the tooth, and you can either try placing it back in the socket, otherwise just in a glass of, you can add milk, there's coconut water, you can even add a little bit of saliva to the glass and drop the milk. What happens is this will maintain the fibers in the root side, which will help the dentist to reimplant it. When you go to the dentist, they will reimplant it, they will clean the tooth, and they will give a splint either in front or behind the tooth. You need to keep it for X number of weeks on the same place with the splint, and the tooth will merge back into the socket, right? This is called tooth avulsion. So next time when your child or you yourself meet with an unfortunate incident where the tooth just pops off, don't worry, don't panic. Make sure that one, you control the bleeding in the socket. Next, you preserve the tooth and you rush to a dentist immediately. If you go there within a few hours, you can save the tooth. It's absolutely fine. You don't have to panic about it. Next is a missing filling. Now, a missing filling sounds like something very simple. Why will this be an emergency? We will tell you why. If a filling is missing, there is a possibility that any food substance can go get stuck in that area, and depending on how much of a space is there due to a missing filling, this can lead to immediate fracture. Earlier in this webinar, I mentioned something called a vertical fracture of the tooth. If your tooth is not protected through and through in the coronal structure, if something happens, it will end up in a crack, and that will lead to immediate pain. Yes, we consider this as an emergency. Depending on the depth of the filling, how big the filling is, you should have this addressed immediately, because it's all in the thought of being a bit more proactive towards the dental treatment, and little bit of neglect in this area might cost you the entire tooth, right? Broken crown is a very common thing that we see today. It can be due to anything. People actually take some time to get used to a new prosthesis in the mouth. It takes about 3 to 4 weeks generally for people. But during that time, when you're eating, when you're biting, if the crown breaks, you need to immediately visit a dentist, simply because your crown can be ceramic, which is what will break. Metal can get a little, bent and broken on the side, but it will give you a very sharp margin. Sharp margin on a dental crown is very risky because it can just cut your tongue from one end to the other, and that can cause a lot of bleeding. It can even nick the sides of your cheek and a little bit of your tongue as well, cause a little ulceration, and that's a lot of discomfort for you while you're eating food and all of that. If the crown is broken, do not waste any time. You've spent a lot of money, time, and effort with your dentist planning that prosthesis. Don't neglect it. Go back to your dentist, and I'm sure they will have a way to either fix this or replace the crown immediately, right? Abscess tooth. Abscess tooth is also one of the most common things. These are infection related. Abscess can be a dental abscess, it can be periodontal abscess, it can be because of your gums, or it can be because of your tooth, basically. If there's an infection on the tooth that goes from above the tooth, it will hit the apex and you will have a bit of a swelling. An abscess is something that needs to be treated with a good amount of antibiotics, 3 to 5 days. And once this is done, we can assess if we can save the tooth by doing a root canal, drain the pus through the canal, and then we can restore it. If not, we might have to remove the tooth, but that's a worst case scenario depending on the amount of infection that's causing bone loss, right? Again, no reason for you to put up with that kind of pain, no reason for you to wait to see will it settle. And a lot of people we've seen in our clinic who come down, they have not visited the dentist. Their first reflex is go to a pharmacy and check over the counter if the pharmacist can actually give you good medicine, right? They tried that. Obviously that doesn't work because the pharmacies here might not have the entire knowledge on infection antibiotics, on how to give antibiotics on what dosage and for what not. And in all fairness, the patient just goes over the counter and asks for them, and they just give you from what they understand. Don't do this. Go for a consult with your dentist and they will be able to give you the medication. Emergency nonetheless, right? The last part, we kept this for last. If it's a food or any object that's dislodged between your teeth, I'm sure most of you are thinking, why is this an emergency, right? How can this be an emergency? If there's just food, I'll floss it out, or I'll take some toothpick and I'll remove it out. If it's soft, great, I think you can do that. We wouldn't recommend it, but you might end up damaging your gums further. But when we say food substances or anything large between your tooth, this can be from something very small to something so big that it can wedge the space between the tooth, and that will cause a lot of issues, right? You don't want to sleep with something impinging your gum overnight. You might wake up with a huge swelling, and these are all potential reasons for infection. right? Now, we've addressed two parts of our question. How do you know if this is a dental emergency? What isn't a dental emergency? Let's get to that. Not everything is considered a dental emergency, and on a lighter note, we've had patients who've come to us and say, I need an emergency cleaning done. No, emergency cleaning unfortunately is not a dental emergency, uh, even if you're getting married, for that matter. You can say, I want to get a cleaning done because I have an event, but it's not an emergency. Emergency is only when it's life threatening and it has infection and anything else. If there's something that you can bear overnight is not an emergency, you can't. Basically, why we're telling this is to prevent you from panicking. We do have patients who come down for smallest of things and really panic. Another very common thing is when patients have not gone to the dentist for a clean and there's calculus in the tooth, tartar, which hardens over time and it becomes calculus. A bit of calculus breaks when they're brushing and they come to us saying, my tooth broke. My tooth broke. How can my teeth break? And then we have a look, there's a big chunk of calculus that's missing. We tell them, look, don't worry. If the tooth broke, you will not be sitting here in front of us smiling and telling us this. Right? It will pain. This will cause an exposure of the nerve and it will hurt. Right? Anyway, moving to the last part. How do you avoid potential emergencies? Visit your dentist twice a year. They will do a consult for you and tell you if there are broken fillings, if there are any sharp margins. Diagnostic x-rays is something that we take in Oralia through an OPG. We have a look at anything potential that can cause harm to the patient. We advocate proactive treatments for all our patients, and most of them follow the treatment, so we avoid any unforeseen fracture or unforeseen infection that's happening. Also, most clinics, I'm sure, I know we do it, we have a comprehensive dental plan for all patients who come in. This is not just addressing the chief complaint, we also address any other dental treatments that need to be done. Like, for example, if there is a badly angulated wisdom teeth for you, we will recommend that you take out time, plan this before it gives you pain, and then you addressing it, right? Things like that. The only way you can avoid dental emergencies just to being proactive with your treatment, routine checkups with your dentist, and even following instructions after the procedure. The most common example is when you have a tooth extracted, there are a certain list of instructions that your dentist will give you. What to eat, what not to eat, when to brush, when not to brush, no smoking after you remove a tooth and all of that. Following that and those instructions are absolutely important. When you miss on those infections is when you end up with something called you end up with something called a dry socket. A dry socket after extraction is extremely painful. 99% of the time, a dry socket is much more painful than the reason you came down to take the tooth out, right? So following instructions. Anyway, that's it for today. We will summarize the entire thing with what are dental emergencies, why are they so important, how do you recognize dental emergencies, after you recognize them, what do you do, what are some common dental emergencies that you may come across, and how do you avoid them, right? Thank you so much for your time and patience with this. We will take some questions if you have any doubts. Yes, we have a few questions we have a question from Rainy Travi. Hi doctor, I have 4 cavities in my lower jaws in the molars and it's spreading too fast. What should I do? Hi Redu, if you've got 4 cavities, I think you really need to go visit your dentist. They will do a diagnostic x-ray to see the depth of the cavity. That's what we do. As soon as we have a look, we will show you also and educate you on how deep it is. And once it's done, we'll plan it based on treatment protocol. Maybe this will be something where we do a deep caries management and we do a filling for you. If not, we'll do a root canal. That's it. It shouldn't take anything more. But yes, if you've recognized that you have 4 cavities in the lower jaw and spreading fast, the first thing you should do is go visit a dentist, right? Okay. Next question. Hi, this is from Farooq. Hi Farooq, how are you? My teeth is chipped, but it doesn't hurt. Is it a dental emergency? Look, this is a very common thing that we've been asked if it's an anterior tooth and if it's actually chipped. It is bound to leave a sharp margin. The sharp margin can actually end up cutting your lower lip. You might end up cutting your tongue, which is very uncalled for. You might want to go to your dentist. Look, if it's a broken tooth, if it doesn't bother you, this just isn't about aesthetics. This isn't about regaining your smile. this is also a little bit about your safety. You don't want to end up cutting soft tissue around the tooth, right? So you go to your dentist, you have a consult with them, and they will give you options on how to restore that tooth. Worst case scenario, even if you don't want to get this done, you can at least smoothen the edges, make sure this is not a sharp edge, it won't damage you any further, right? I hope this helps. Okay, last, Sunil Kumar, how do I address tooth pain? Hi Sunil, Sumit, sorry. You can address tooth pain in different ways. The most important way of addressing a tooth pain is to figure out why you're even getting pain to begin with. Etiology of pain is very important. Depending on infection, is it a broken tooth? Is it something to do with gums? Is it something to do with bone? Once we discuss and once we arrive at a conclusion, reason for pain, there are different ways on how you can address the pain, right? If it's an emergency, if you're not here, if there's no dentist available, if you're traveling, you can always get in touch with your dentist. There is on paper pain management protocol with some painkillers. If there's an infection, maybe some antibiotics, and all this is just temporary. The painkiller will take the edge off. This is something that we want to tell all our patients every time. Just because we give you painkillers doesn't mean this will cure it. Curing it may need a treatment, right? Painkiller will take the edge off, it will give you relief. Once it gives you relief, please don't neglect it, because next time when you get pain, intensity will be twice, and the dosage of painkiller you'll have to take will be double, right, to make it better. That's it. I hope that addresses your question, Sumit. Thank you so much. Any other questions, please do let us know. Also, if you'd like us to do any webinar on a certain topic, you can let us know. Please leave a like, and you can follow our page as well. Thank you so much for your patience for today. We've taken 22 minutes. Have a nice day.